The Northern Corridor Transit and Transport Coordination Authority has sounded the alarm on the health of truck drivers who move cargo from the Port of Mombasa to the East African member states along the Northern Corridor. The Intergovernmental agency says about 60% of the drivers have health conditions. Speaking in Mombasa, the Executive Secretary, Dr. John Deng, says poor health among more than 3,000 drivers in the corridor is a major red flag for road safety, and urgent interventions are needed to address both economic and social issues. The findings also indicate that the corridor continues to be a critical conduit for transboundary infectious diseases, including Ebola, Marburg, COVID-19, HIV and AIDS, and recently Mpox. The agency is now seeking interventions and policies to support the drivers and communities they interact with along the corridor that serves Kenya, Uganda, South Sudan, Rwanda, Burundi, and the DRC.
In developing these facilities, and our intention is to support them. Member states are developing guidelines and regulations on how these roadside stations should be developed and operated. And the private sector is taking up this very seriously. They are buying land, developing these facilities and operating them as a business, but also supporting the objectives of the corridor.
What we are going to do is, in this engagement, we are going to come up with three things. One is to have some sort of a structured or institutional semblance on how to handle this. Because health issues, now what happens in Kenya, Kenya reacts alone without a proper institutional setup that coordinates with the authority, other than traditional institutions that have traditional roles. One. Two, we are going to look at transcendence policies. What policies do we have that bring countries together to treat this as a common affair?